Hi everybody, this is Dr. Kevin Smith. Thank you very much for checking out this video on secret number 2 of why you still suffer with low thyroid symptoms. As we said in the previous video, there are a lot of components and structures in the body that are involved in the thyroid pathway. These involve structures in the central nervous system in the brain, such as the hypothalamus and the pituitary gland. It also involves the thyroid gland itself, the liver, and the gastrointestinal tract. And as we said before, if there's a problem with any of these structures, then the thyroid pathway doesn't work as it was intended to. And in the previous video, we talked about how there was a lack of a neurotransmitter called serotonin, which was a precursor building block to being able to make thyroid hormone. And in this video, we're going to talk about the second reason, the second secret why you could still suffer with low thyroid symptoms. Now, just to review the neurology, in the brain you have the hypothalamus and you have the pituitary gland. In the hypothalamus, there's a structure called the paraventricular nucleus that requires certain neurotransmitters for it to be able to produce a hormone called TRH, or thyrotropin releasing hormone. TRH then sends a signal to the pituitary gland to produce TSH, or thyroid stimulating hormone, and the TSH then sends a signal to the thyroid gland telling it to produce thyroid hormone. Now, in the paraventricular nucleus, there is another neurotransmitter along with serotonin called dopamine, and dopamine is produced in the substantia nigra, which is in the brainstem, and it's also produced in the ventral tegmental area of the midbrain. And dopamine is one of the two neurotransmitters that's required by the paraventricular nucleus in order to be able to produce TRH hormone. So that is the second hidden reason why you could have low thyroid symptoms, is a paraventricular nucleus defect caused by a insufficient amount of dopamine, or dopamine deficiency. Now, people that have low dopamine, we can't test for this on traditional lab tests. It doesn't show up in a blood test or a urine test. So the only way that we can determine if you have low dopamine in your system is by doing a neurotransmitter assessment based on how you're feeling. And people that have low dopamine typically have feelings of hopelessness, worthlessness. They tend to isolate themselves from other people. They have low libido. They require caffeine just to keep themselves going throughout the day. They are easily distracted. They feel a general lack of concern for other people, including loved ones. And there's a variety of classical low dopamine symptoms associated with this type of presentation. Additionally, people that have low dopamine problems that are affecting the paraventricular nucleus, on your lab test you will have low TSH, again because you're not making the building blocks to be able to make TSH, and you will also have low T4 levels. Now, when we combine the neurotransmitter assessment as well as lab testing, we're able to kind of determine where the problems are coming from. These are problems that are very common, and yet they're not picked up by traditional medical tests. Well, again, your traditional medical doctor, your primary care, or medical endocrinologist very rarely, if ever, is going to look at the central nervous system and look at neurotransmitters as a root cause. It doesn't change their treatment plan, and it's not something that they typically will assess. So some of the causes of why people develop low dopamine in their system includes destruction of the cells that produce dopamine, such as the substantia nigra, and that's commonly affected with, late stage of that is associated with Parkinson's disease. Overuse of caffeine, overuse of nicotine, and specific recreational drugs such as marijuana and cocaine use can all blunt the receptors for dopamine and or inhibit the actual manufacture of dopamine. I hope you enjoyed this video. I hope you learned something. If you have any questions, please feel free to send me an email from my website at integratedmetabolic.com. Please subscribe to my YouTube channel, and please tell a friend. This is Dr. Kevin Smith. Thank you very much for checking out this video.